Heartwarming. So, the biggest walkout in NHS history starts today with a coordinated double strike by nurses and ambulance workers in England and Wales.
And that's despite the head of the Royal College of Nursing, Pat Cullen, writing directly to the Prime Minister, asking him to intervene ahead of today's industrial action, which is expected to involve tens of thousands of health staff. So, Pat Cullen, head of the Royal College of Nursing, joins us now in the studio. Pat, thank you very much for being here with us. Well, it's not getting any better, is it? Today is a massive day of what appears to be coordinated action with the ambulance workers, and we've got a massive week of health worker strikes. I think Wednesday is the only day that there won't be health workers on strike. How come we're no closer to getting a deal?
Well, I think that's a question you need to put to Rishi Sunak. I wrote to him on Saturday, and again, I'm waiting on a response and I haven't got one. And I think that says a lot, given that he knows that we are taking strike action today.
What did you say in your letter to him?
I said to him, look, that he can stop the strikes happening. He can get round a table and start talking to me. It's now weeks since I've heard from anyone in his government, knowing that today and tomorrow is happening. And I did say clearly to him that he must start to talk to me. He is punishing nurses now in England. These nurses are now paid the worst across the UK when you look at what's happened in Wales and Scotland. And is that fair? It most certainly isn't.
It's interesting you make that comparison to Wales, because there does seem to be progress in Wales over nurses' pay. What is the difference between what's happening in Wales and England?
Well, we're getting round a table and we're talking. And we always said in the Royal College of Nursing that when an offer was put on the table, that we would trust our members and put that offer to our members. And during that period, we would cancel any strike action.
So you've
that's
called
exactly
off,
what we've done.
You've called off the strike action in Wales. The renewed pay offer from the Welsh Government was an extra 3% on top of the 4.5% already tabled. Do you get any indication that Steve Barclay or Rishi Sunak might consider that? And would that mean an end to the nurses' strikes in England?
It's very hard for me to answer that, because for the 3 meetings that I've had with Steve Barclay, he's made it very clear, in fact, abundantly clear, we'll talk about anything but the dispute and strike action and pay.
So what do you talk about?
I raise a number of professional issues that are also really, really important for patients and for our profession. But fundamentally, this dispute is about pay. 47,000 vacant posts, 35,000 nurses left last year in England alone. So we have to address those issues. And at the core of that is the issue about pay.
Yeah. Lots of our viewers getting in touch this morning. The vast majority very supportive of what the nurses are doing at the minute. But there are a growing number of people who are getting frustrated and are now sort of turning and thinking, look, we need to get everybody back to work. For example, Sarah has got in touch saying, my surgery was cancelled today. I've been waiting 3 years for this surgery. I'm just devastated. It's a really important surgery. I'm no longer supporting the strikes. I think for the last strike, it was 48,000, estimated 48,000 appointments or surgeries were cancelled. There's more of the trusts going on strike today and across this week, so that should escalate probably over 50,000. What do you say to Sarah? What do you say to those people, Pat, who are just desperate for their appointments and their surgeries and can't afford for them to be delayed? She's waited 3 years as it is.
Yeah. What I would say to Sarah, I am so sorry. I'm sorry that Sarah's had to wait 3 years, because she shouldn't have had to wait 3 years. And why did she have to wait 3 years? Because there's 47,000 vacant nursing posts in this country, 35,000 left last year. And if we had those posts filled, Sarah wouldn't have to wait 3 years. She wouldn't be one of the 7 million plus people sitting on waiting lists year on year. She'd be able to get on with her life. That's why those nurses are standing on picket lines today. That's why they're losing a day's pay, to stand up for their patients and stand up for the health service.
Flopsy says, I'm due surgery on Thursday and worried it'll now be cancelled to fit the people who were due to be operated on today. COVID already meant surgeries were being delayed by years. Now we have extra delays caused by strikes. So many people will be suffering and others will die waiting. It's quite a responsibility, isn't it, on the shoulders of striking nurses?
It is. But those nurses have shouldered that responsibility now year on year. with their patients having to sit, like Sarah and like our other patient, sitting waiting on waiting lists. And what they're saying is enough is enough. It's those nurses that have to sit in front of those patients and say, we're terribly sorry, your surgery's cancelled again. We're terribly sorry we can't treat you today because we don't have enough nursing staff. They are standing up for their patients. And listen, today, the Prime Minister must step up and step out and resolve these strikes for the people of this country and for nursing staff.
Last week, Rishi Sunak said that if it was down to him, he would like to give you a pay rise, but with conditions. Let's have a listen.
You're right, nurses should be an exception, and that's because they do an incredible job for all of us, and they demonstrated that during the pandemic. And we did treat them as an exception. You know, people forget that actually during COVID, when I was Chancellor, we instituted a public sector pay freeze. I would love to give the nurses a massive pay rise. Who wouldn't? Certainly would make my life easier, wouldn't it? Right now, there's a record amount of money going into the NHS, but we have to put that in lots of different places. We need to hire more doctors, more nurses.
He'd love to. There's a record amount of money going into the NHS, but he needs to use it in different ways. Does that suggest to you that he's not going to budge?
Look, I wrote to the Prime Minister after listening to that interview and said to him he can resolve this impasse. And the record money that's going into the health service is certainly not addressing the crisis within the nursing workforce. And he will only resolve the issues within the health service if he resolves the issues within nursing. So they're one of the same thing here. And he cannot keep on talking about putting money into buildings and machines. Those buildings and machines are nothing without the nursing staff and other healthcare workers to operate them.
There'll be people waking up this morning looking at the front of the Daily Mail with the headline, "No wonder NHS can't afford union pay demands." They're spending £400,000 a day in the NHS for private ambulances and for taxis to get people to hospital appointments and to surgeries. I think it's £145 million was spent last year. When you realise there's £145 million being used for that, you kind of look at it and think, why on earth can't they find the money to try and appease the situation?
Absolutely. I think that tells its own story, doesn't it? It's a false economy, putting money into short-term projects, short-term measures, instead of actually looking at a more strategic long-term plan for the health service, and stop using opportunities just to put money in and take money out when they feel like it.
Also, billions is spent on bank nurses, agency nurses per year. Are you seeing members leaving staff nursing within the NHS and trusts and going to agencies because they're going to earn more money?
Yes, we are. Significant numbers for a number of reasons, simply because they can earn an extra few pounds. And we're losing those nurses out of the NHS, giving up their NHS contracts to do that. And again, that's the short-termism of this government to push nurses to that position. And indeed, they're getting an extra few pounds. They're certainly not getting the additional excessive money that's going to those agencies to try and keep those agencies going.
Pat, we're going to be speaking to Maria Caulfield a little bit later on. She's the Minister for Mental Health. She's a nurse herself as well. What would you say to her if you were sitting opposite her at the desk this morning?
I'd say to Maria, because she's one of our members, she's a member of the Royal College of Nursing. Maria knows what it's like at the front line. She talks about having worked during the pandemic. So walk in the shoes of every single nurse that's trying to work a 14-hour shift with depleted resources, half their workforce missing. And I think she'll make better decisions if she does that.
Unfortunately, we're having a few problems with your mic, I'm afraid, Pat. So apologies for any interference that we may have had on the mic. I wonder if that was the government somehow getting in there, trying to cause you problems.
I think you came over loud and clear, though, with your message and your message to Maria Caulfield, which we will put to the government when we speak to her after 8. Pat Cullen, thank you very much indeed for joining us this morning, and thanks to you for getting in touch with your situation. Victoria says, last week at 1 a.m, I had to call an ambulance for my 6-year-old who was having a severe asthma attack, to be told there are none. We managed finally to get him to hospital ourselves. He was in oxygen 24 hours a day. For 6 days in all, and endless nebulizers, the NHS is broken. As I have said repeatedly on this programme this morning, I think a lot of us frightened to call 999 right now because we don't know if an ambulance is going to be able to
And then you
come
get
out.
messages from Amanda. I'm somebody whose life has been saved by a nurse who stayed with me for 20 hours, forcing blood into me. When I spoke to her 2 weeks later to say thank you, during the conversation, she told me she was having to leave nursing. She could no longer afford to live on the salary she was earning. She went into advertising. What a waste of talent.